So you or someone you love is thinking about taking testosterone. Maybe already has, and you're wondering when you might see the impacts of this hormone replacement therapy, or HRT. In this video, I'm going to be breaking it down for you, not only as a trans person myself who's been on T for over 15 years, but also as somebody with a doctorate in gender studies who's done the research. I'll be outlining what to expect immediately within the first 3 to 6 months, the first 1 to 2 years, and in the long term. And I will remind you that everybody's different, and there's a lot of moving factors when it comes to hormones, including genetics, dosage, the age that you started. So this is not a be-all, end-all, but instead a general guideline. And in case it isn't obvious, I'm specifically talking about people who are assigned female at birth, who are taking testosterone as part of gender-affirming care. Now, before you even start, many people begin with a social transition. This can mean coming out to the people you love, changing your name or pronouns, changing how you dress. It might be in just some circumstances. Maybe you're out at school, but not at home. Or you're out at home, but not at work. Now, back in the day, there actually used to be a requirement before gaining any access to gender-affirming care that you had to be openly living as your gender identity at home, at work, at school, no matter what, for a minimum of a year before they would even consider giving you hormones or surgery. Now, this is a big barrier for some people who don't live in a safe environment where they can pursue that. That is kind of the way of the past, but I do recommend if you are seriously considering medical transition, you carve out even a small part of your life to live openly as yourself, even if it's just at home, to really get a sense of who you are and what you're looking for out of this journey. I say this as somebody who came out as trans at the age of 16 and who started hormones around 18, had top surgery around 19. It was a total of around 2.5 years before I accessed medical transition, and really 3 to 6 months on T specifically before I saw any long-lasting changes. So I know there's a lot of us who wish we could just snap our fingers and wake up a different gender, but the reality is it's a very long journey. If you're seriously considering medical transition, the next step is to then talk to your doctor. In Canada, it's your GP, general practitioner, family doctor. They'll probably begin with a review of your personal and family medical history, do a physical exam, blood tests. They might identify and make a management plan of any complicating factors like smoking, drug use, or any other chronic health problems you may have. You might want to discuss birth control and fertility, and even take steps to preserve your fertility, like an egg retrieval. You'll probably discuss your mental health and your history of gender identity, any sense of dysphoria you might have, any other mental health concerns you have, your sexuality, your sexual health risk, your risk of self-harm, and what support you have from friends, family, or your community. All of these are part of a holistic approach to supporting you through the transition process. Your doctor will talk to you about making a care plan and how to monitor your hormone levels with things like blood tests, which you'll probably start doing every few months and eventually do about once a year. If you're beginning this process and you're under 18, you'll likely need a parent or guardian to sign off on this, and I recommend that you work directly with a healthcare provider who is experienced in providing support to gender diverse youth. Once you and your doctor feel ready to move forward, you'll get a prescription for testosterone, which is usually in the form of an injection that you take once a week or once every 2 weeks. You can do the injection yourself, or you can get a nurse to help you with it. I taught myself how to do my injections using YouTube. There are also other options, including gel and pills, but you have to take those daily, so many people prefer to do the once a week option. Now we're getting to the fun part. What to expect during your first 1 to 6 weeks on testosterone. Well, for better or worse, the first thing many people notice is that their skin changes. It often gets a bit more oily, you might get some acne, and this can go on for at least a year, if not indefinitely. Welcome to your new skin type. You'll also probably see an increase in energy levels. Many people find an increase in mood. You're also very likely to have an increase in your libido. A lot of people also mention that they start to feel very warm, like they run hotter than they used to. And I have seen some trans guys say, now I realize why all the teen boys are wearing shorts out in the middle of winter. It's because they're hot. Now, in months 2 to 6, you can usually expect your voice to start to crack and change. This usually begins around 3 months, and it can take multiple years before it really settles into its new range. If you're specifically interested in the impacts of testosterone on your voice and trans voice in general, check my previous video on the topic. Around 3 months in, you'll usually stop getting your period, although I know trans men who have continued to have it for many months or even years. Generally speaking, that's when you stop. This doesn't mean that you cannot get pregnant, so please continue to use precaution when sleeping with people who produce sperm. Also around this time, you'll start to experience what we in the community call bottom growth, which usually grows you around 1 to 2 centimeters, and it comes with a lot more increased sensitivity, which combined with your increased libido can mean you might want a lot of alone time during this period. Or if you have a really enthusiastic partner, you two are going to have a lot of fun. Now, at the same time, you're also going to be experiencing some other changes down there, including dryness, a thinning of your lining. You might find that your labia decrease in size. All of these things can actually make penetration more painful or cause cramping. And if you're having any issues, I recommend speaking with a pelvic floor therapist who's experienced working with trans patients. And many people find that their emotions continue to change during this period, and I know that I had a harder time crying around 3 to 6 months on T. Around 6 to 12 months, your voice will continue to change and drop, and this is one of these things that cannot be reversed. Once your voice goes down, it does not go back up. At least not without training. You'll also start to notice increased muscle mass and strength. This starts around 6 months and can take multiple years to really build up. Many people will also see their body hair increasing and some facial hair growing in around 6 months to a year. But this, again, can take multiple years. Personally, I didn't get a proper beard until about 5 years on T. Once you hit the 1 year mark, the changes become a little more slow and progressive over time. So over the first 1 to 3 years, you're going to be looking at continued changes to your voice. It usually takes 2 to 5 years to really even out into your new natural tone. The hair on your body and your face will continue to develop for around 3 years. Like I said, it was around 5 years before I really got a beard growing. Your muscle growth will really kick in around 2 to 3 years. So if you're the type of person who wants to get bulky, keep at it and you will grow. Your bottom growth usually takes around 1 to 2 years and then it sort of gets to where it's going to go. During these initial years, you'll also probably notice a change in your hairline. At first, I thought I was losing my hair, but what was actually happening was that my hairline was just receding, and then it stopped, and that was my new hairline. So if you notice some of your hair is starting to fall out within the first couple of years on T, this doesn't necessarily mean you're going bald. However, if all the men in your family are bald, you may be going bald. Some people don't mind going bald and in fact find it as an affirming part of their masculinization. However, if it's not something that you want for yourself and you're concerned about it, talk to your doctor about preventative measures. Like I said in a previous video, I recently started finasteride because I did actually start going bald, like my dad and my granddad. Now I am taking this pill once a day to help keep my hair where it's at. And for the record, it's doing all right. Now, I did mention that around 3 to 6 months, your body fat begins to redistribute, but you'll really start to notice the difference around 2 years in. This includes the fat on your chest. So if you haven't had top surgery, you might notice a change in your chest tissue where they look sort of flatter and more like man boobs, for lack of a better word. If you have had top surgery, it'll be even more obvious that you're gaining more muscle in your pecs. Also, probably notice a change in your face shape. As you have more muscle, less fat in your cheeks, and maybe some hair coming in, generally you'll look more masculine around this time period. And for those of us who want to be easily read as a man in day-to-day life, this is around the time people will probably just start clocking you as such on your face card. Again, depending on your genetics, age, body structure, etc. In the long term, like 3 years and more, you're going to see some continued changes with your body fat, muscle, facial hair, hairline. A lot of that stuff also just starts to change and grow with you as you age. Many aspects of HRT are reversible, but there are some that are not, like your lower voice, hair growth, and bottom growth. Similarly, there's some things that just can't be altered by testosterone, like the width of your pelvis. Although your fat might redistribute so you feel like your hips are less noticeable, they'll still be the size they are when you start. Overall, trans healthcare is really under-researched and really misunderstood. There's a lot we still don't know. And again, I want to stress everybody's different. Genetics plays a big factor. If your dad doesn't have much of a beard, you're probably not going to have one either. And age is a big deal as well. People who are younger, under 18, might face additional barriers to accessing gender-affirming care, especially if they don't have a supportive family. Also, for young people pursuing HRT, a lot depends on whether or not you had blockers. And that's because skeletal dimensions can be altered on HRT, but only if your endogenous puberty, the puberty you were getting the first time around, has not yet completed. As I stated earlier, I started at 18. I hadn't had blockers, and I still went up a shoe size, got wider shoulders, and grew 2 inches taller, 5'5" to 5'7". In my case, because I wasn't completely through an estrogen-based puberty, I got some additional additional side effects from T, ones that I would not have gotten if I had accessed it later in life. On the other hand, people who start later in life, 30, 40, 50, might find they don't get all of the changes they were hoping for. If, for instance, you start T in your mid-30s, your voice might not drop as much as you hoped it would because your vocal cords have ossified. But don't let that stop you from pursuing your transition goals. There's never a time that's too late to start. And you can always take additional steps to achieve your transition goals, like voice training, hair transplants, surgery. And if you start and it's not feeling right, there's nothing wrong with stopping, taking a break, lowering your dose. Make sure you just work with your healthcare team and the people you trust. Even if you've been on HRT for a long time, if you feel like it's not working for you, it's okay to stop. Many people get the changes they want and then pause, take a break, or stop entirely because they don't want to have to maintain it. Like I said, those irreversible changes like your facial hair or your low voice aren't going anywhere. The only reason to not stop taking your hormones is if you've had surgery to remove your gonads, like a hysterectomy, in which case you do need to take something to maintain your bone density. There are also a couple of health concerns to keep in mind when you're starting T, including potential impacts on your liver, although most of the time there's no cause for concern or liver enzyme monitoring. There also could be potential impact on your cardiovascular health, but that is more of a concern for trans women than for trans men. If you need advice, guidance, or support in your transition, talk to your doctor and your trans elders. I recommend seeing if there's a trans support group in your area. You'll probably find the older trans folks there running the place. For a long time, the trans community has been at odds with our healthcare providers. Many of us continue to struggle to get the care that we need. Sandy Stone talks about this in her post-transsexual manifesto, where there's this long-standing history where the doctors and psychologists want to study this thing, the gender identity disorder, and the trans people just want to get access to the care we know we need. But things have changed in the last few years. Even since I started my transition, there are a lot of great providers who do want to work with us. And being trans is no longer considered a mental illness. Instead, our dysphoria is recognized as the main cause for our concern, and that is something that can be treated using gender-affirming care in a manner that's tailored to each unique individual. Only around 0.3% of Canadians identify as trans or non-binary. That's 1 in every 300 people. In the US, I think it's about 0.5% of their population. Young people are more likely to identify as trans or non-binary, which could be for a number of reasons. Certainly there are some who are just experimenting with their identity, but there's also been a huge change in the political landscape in just my lifetime, and it is now much easier to be openly yourself than ever before, even with the rise of anti-trans backlash. And of those tiny fractions of a percent, even fewer are actually pursuing medical transition of any kind. Those who do rarely regret it. We're talking less than 1%, although the actual numbers of regret may differ slightly since it tends to be underreported. But if you contrast that with something like, say, knee surgery, where 18% of patients have discontent, we can see that gender-affirming care is a safe procedure and one of the best ways to treat gender dysphoria. Despite knowing all this, our healthcare remains extremely politicized. In 2025 in the US, there were 147 anti-trans bills and 57 passed. In Canada, our freedom of expression and access to healthcare are also under risk. For instance, Alberta's Bill 26 limits access to gender-affirming care for anyone under 18, including blockers. In the same province, Bill 27 limits access to sex ed and forces the outing of trans kids at school. And I know there are a lot of people who feel like this kind of thing is just protecting women and children, but these bills restrict freedom and healthcare of all people. And we know historically it has often been trans kids who are under attack first, and then trans adults, and then everyone. Now, more than ever, it is so important that we have accurate, accessible information about our healthcare. And for that reason, I hope you found this video informative, and if you're interested, I'd be happy to do a follow-up, including one all about the impacts of estrogen. But for now, thanks for watching. Remember to like and subscribe, and I'll see you next week.